Hi, I'm Winnie and I'm the pelvic floor physio of Papaya Clinic. So today I want to talk about pelvic organ prolapse and the use of Pessary. So you might be watching this video because you are experiencing pelvic floor dysfunctions, for example, urinary leakage or heaviness and bulging of the vagina, or you might have sensitivity in the pelvic floor tissue, and so your pelvic floor physio might have done an internal assessment and have suggested Pessary. So I want to go into a bit of a detailed look on what Pessary is, to help you make an informed decision of whether Pessary is for you or not. So if let's say you're having leakage or bulging sensation, this is the anatomy to start with. So hopefully your physio have explained this to you, but I'll go through this again. So I'm going to explain the anatomy for you again. So this is the front pubic bone and this is the back and the coccyx, right? So the tailbone. Now this is a bladder and this is a urethra. Yeah, so wee comes out through the urethra. That's the vagina opening, vaginal wall, and then uterus is here. And then this one is the anus going into your rectum. Yeah, so stool is kept in here, and then when your anal sphincter relax, then stool comes out and you pass a bowel motion. So what happens when you have pelvic organ prolapse is sometimes the walls of the vagina tissue, so you have the front wall, the anterior wall, where it is behind your bladder, and you have the back wall, which is in front of your rectum. So the front and the back wall might have a laxity issues or integrity issues. So what happens in pelvic organ prolapse is we see that the connective tissue of your vaginal wall is compromised. And that could be because of a couple of things. It could be labor, a very long, prolonged second stage of labor. It could be use of forceps and vacuum. It could be chronic cough. It could be obesity, overweight. It could be chronic straining as well when you're passing a bowel motion. So all of those things add extra load to your vaginal walls. And over time, accumulatively, the vaginal wall connective tissue start to be compromised. Now, sometimes that can be due to hormonal issues as well. So for example, when you're acutely postpartum or the first 12 months after you had a baby, or if you're going through perimenopause, the hormones will affect the change of the vaginal wall integrity. And so you can also experience more symptoms because of this integrity issue. So what the Pessary does is, if you imagine there's a front wall and the back wall and the top wall. So front wall, bladder, back wall, rectum, and top wall is your uterus. Now, if any of these walls are collapsing and coming down while you are coughing, laughing, sneezing, or what we call bear down, then what happens is as you bear down or as you exercise, sometimes the wall will collapse down and where you will feel a bulging sensation or a heaviness sensation. So what a Pessary does is actually we insert, this is one of the Pessaries, there's a cube, but it also comes in rings, it comes in gill horns, some of them have suction, some of them have not. So for example, this one, you can see there's suction in there, right? So it's concave, and so when it goes in, it can suction to the walls and provide a little bit more support. But what happens is with the Pessary, we put this silicone structure inside the vagina up and it sits underneath your cervix. So what happens is when you are bearing down or exercise, laughing, coughing, sneezing, you have peace of mind that the Pessary is there and keeping your walls intact. The walls are not coming down because you're fatigued or because you are end of the day and your connective tissue is getting tired and so things are falling down. So it is peace of mind to just hold your vaginal walls still. Now, how it helps with urinary incontinence as well is sometimes you might have a very strong pelvic floor muscle. So in your internal examination, we do test for your muscle tone and your performance, how well you can contract and relax. That is really, really important. As you can see, where your pelvic floor layer is really important that as you contract, the pelvic floor has enough integrity and tone and strength to be able to close your urethra by generating a pressure from anus towards the front. So it acts like this, and it closes the urethra in the front. Now that is a very important mechanism to make sure you stay continent. However, sometimes your pelvic floor might be strong, but you still experience leakage because of a lack of integrity in your connective tissue. So instead of actually pelvic floor closing and closing your urethra, what it's doing is actually just pushing everything forward and everything is a bit laxed. So there's no sort of back support for things to close towards, yeah? And so in that stage, the Pessary is really, really good to provide that external or internal support to create pressure so that when you are using your pelvic floor, it's more effective and your anatomy is in a better position. So as you close, you can actually generate the pressure that you need to close your urethra and stop you from leaking. So if you think Pessary is for you, the first thing is to go on the website, and there is 2 really nice handouts to look for. So under Papaya website, under patient resources, there is one called stress urinary incontinence, and the other one is pelvic organ prolapse. It is an Australian consumer guideline, and it goes through all the management options, the different types of prolapse, and how Pessary can be effective in managing your symptoms. I highly recommend you to read through those 2 handouts and hopefully watch this video and get more insights to how Pessary can help you to manage your symptoms. If you do fit the Pessary, normally it takes 30 minutes or so for a Pessary fitting, and it's kind of like fitting a bra. It comes in many different shapes and sizes, and we need to make sure that it's not just about being inside, but your pelvic floor can actually hold it as you walk around and as you do exercise. It doesn't slip down, and it doesn't irritate your vaginal tissue as well. There is no spotting or lacerations, and that you can actually self-manage, which means you can put your hand in and take it out and then put it back in whenever you need to. The different types of Pessary means that the management is quite different, and we will go through that with you during the consultation. As you can see, there are some suction type Pessary and there's some non-suction type Pessary. A very common one that we like to start with is a ring Pessary. It is like a calamari ring, and you squeeze and you put it in. If you are familiar with how to insert a menstrual cup, that will be really, really simple for you because it's quite similar. And with a ring, because it has a hole in between, you can continue to have sex with the Pessary. You can put tampons, you can put your menstrual cup in. You literally can keep it inside for 6 months without taking it out. And at 6 months point, you take it out, you wash it, and you put it back in. For some Pessaries that have suction, then the management normally is every fortnight. You do have to take it out, wash it, and put it back in. So the type of Pessary that you choose really depends on a couple of things. How your vaginal tissue is acting at the moment. Is there a hormonal imbalance in there? How's the integrity of the tissue right now? How strong your pelvic floor is? And also, how severe are your symptoms? So during the consultation, we'll go through all of those with you. If you have any questions, please reach out to your physio and our team, and we can answer that for you.